views and comments of the hosts and guests are not necessarily those of the station.
This is Francis de Guzman on Good News Pilipinas, where we have our discussions of the day and the issues that involve advocacies of life and truth. They matter. Airing on DZRJ 8:10 a.m. Radio Bandido TV. Good News Pilipinas.
Watch and listen to Good News Pilipinas, Thursdays, 12 p.m. to 1 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Ito po ang inyong kaibigan, Jimmy Morato, nag-aanyaya sa inyo sa inyong palatuntunang 𝗂𝗶𝗁𝗵𝗶. Dito pa rin sa inyong paboritong AM station sa buong Philippines at sa buong mundo, DZRJ 8:10 AM Radio Bandido TV.
Watch and listen to 𝗂𝗶𝗁𝗵𝗶, Monday to Friday from 4 p.m. to 5 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station. The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with Makati Med as we discuss the latest health and medical topics with doctors from Makati Med. For a healthier and uplifting lifestyle, tune into Healthline with Makati Med on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with Makati Med, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from Makati Med interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with Makati Med. I'm your host, Nicole Jacinto. Today, we're going to talk about conjunctivitis. Yes. A lot of people might be getting that these days. And our guest today is Dr. Justin Raymond G. Manlongat, who is an ophthalmologist, or his specialty is ophthalmology. There's a difference between an optometrist and an ophthalmologist, but they work hand in hand. So listen carefully, folks, as we discuss conjunctivitis. It's probably, well, I'm sure a lot of us have had it, and it's very common. So we can learn more about it today. Good afternoon, Dr. Manlongat. Thank you for being with us today.
Yes, good afternoon, Dr. Nicole, and good afternoon to all the viewers of your program.
Oh, thank you, doctor. By the way, any relation to Charina?
𝗠𝗸𝗵𝗹𝗁 is my first cousin.
Okay, please give her my regards. Yeah. Okay,
Oh,
please.
sige po, Doctor. I'll do that.
Okay, yeah, I'm not a doctor, but thank you. Maybe it's just the outfit. Okay, so Dr. Manlongat, what is conjunctivitis like? Is it what we know as more commonly as like, is it the same as what we call like pink eye or sore eyes?
Yes. When we talk about conjunctivitis, although there are many types po, no? But if you say conjunctivitis in the Philippines, we commonly term it as sore eyes. And then in other countries, like in the US, they commonly term it as the pink eye.
As the pink eye, okay. So doctor, what's the actual literal meaning of conjunctivitis?
Okay. So conjunctivitis is the inflammation of the part of the eye that we call the conjunctiva. Okay, so the conjunctiva is the thin and membranous layer of the eye that is covering the surface of the white part of the eye, which we call the sclera. And it also lines the inner part of your eyelids, which we call the palpebral conjunctiva. So any inflammation of any parts of those parts of the conjunctiva, then we call it conjunctivitis.
Okay. So if there's a thin membrane of please correct me anytime, doctor. I'm just trying to recap and understand, explain it better to someone like myself and to the rest of the audience. So it's not like in what we think of as just the eye itself. No, maybe there's a membrane, as you said, around the whites over that covers the whites of our eyes, the white part of our eyes, and also under the eyelid.
Yes, correct.
And if any of those, if any of those parts are inflamed, so that's what you call the conjunctiva. And if any of those parts are inflamed or maybe red or then that amounts to conjunctivitis. Okay, doctor. Thank you for telling us that, because a lot of us wouldn't really know what the conjunctiva is and just like think it's part of the eye. At least we know that that's it, and that it entails even the eyelid, the inner eyelid. Okay, so are there different types of conjunctivitis in terms of like maybe how you contract it or the nature of the conjunctivitis itself, like either bacterial or is it allergic? Is it viral? Are there different types?
Yes. So there are many ways that we classify conjunctivitis, no? But one of the more common ways to classify it is as to the cause of the conjunctivitis. And the two major categorizations in terms of the cause of conjunctivitis is either the infectious type and the non-infectious type. Okay. So for the infectious type, the more common ones that we usually encounter in the clinics are viral conjunctivitis, which accounts the majority of cases of infectious type of conjunctivitis, and less commonly the bacterial type of conjunctivitis. And then for the non-infectious type, we also have what we call the allergic conjunctivitis, as you have mentioned. But there are other less common causes of non-infectious types, such as toxic conjunctivitis.
Toxic conjunctivitis. Okay, let's get into all of that. Doctor, well, before that though, so can anyone of any age get conjunctivitis?
Yes.
Like from baby? Yes, okay.
Yes.
All right.
But
So,
of course, but there are certain age groups that are more susceptible to certain types of conjunctivitis. But yes, all ages can get conjunctivitis.
okay. So anyone of any age can get conjunctivitis, and as you said, there's two major categories: infectious and non-infectious. And for when it comes to viral and bacterial conjunctivitis, you said viral is more common, no? Can you tell us how you get viral conjunctivitis first before we move on to bacterial?
Okay. Well, there's a considerable overlap in the ways that we do transmit, or that people get the conjunctivitis, no? Whether it's viral or bacterial. But for viral, a common way to get viral conjunctivitis is through other people. The transmission is commonly through direct contact. So usually from hands to the eyes, or indirectly from the patient's hands, and then they touch common objects, surfaces like doorknobs, buttons, yeah, and mga computers and other objects. And then if someone who does not have conjunctivitis also touches the same object, and then they touch their eyes, then that's one of the more common ways that one can get conjunctivitis.
So it's not that's her viral, no, doctor. So if it's not, but there's an overlap, as you said, with bacterial.
Yes, but that can also be true for bacterial conjunctivitis as well.
Okay, thank you, doctor. So just reminding people out there again why we always say wash your hands, or make sure objects are clean, whether or not there's COVID or anything other thing that you're afraid of, because as you said, okay, it's transmitted from person to person. But let's say like I have, for example, please no, don't give it to me. But for example, I have conjunctivitis, right? And it's viral, and then I can't help but rub my eyes. Then I'm glad you mentioned computers, because a lot of people don't, normally think of that, especially if you maybe all work in one office or in a family, and then you tend to use each other's computers, and then you touch the surfaces. So it can be transmitted through surfaces also, or like, you touch the eye, then, shake the hand, that kind of thing.
Yes. So that's also one of the more common ways, handshaking. And then there are some people, for example, even in swimming pools, in public places. So a lot of us think that since swimming pools are chlorinated, so the tendency is we'll think it should be safe, correct? But unfortunately, even viruses that are responsible for viral conjunctivitis or even bacterial conjunctivitis, they can survive those conditions. And sometimes you do get the history of people coming in that they did go to the beach or they did swim a few days before they show signs and symptoms of conjunctivitis. And then probably other ways that these can be transmitted is, for example, among women, is the sharing of makeup. We do get that a lot from patients from the female population, that sometimes they did transfer the virus by sharing some of their makeup with their friends and relatives.
Thank you, doctor, for mentioning all of that. I mean, that's great. That's so like specific, and many things that many times people won't think about it.
Yes.
And as you said, you mentioned the swimming, so chlorine does not kill it. The virus or the bacteria, the virus or viruses or bacteria that causes conjunctivitis, chlorine does not kill it. So if you swim in a chlorinated swimming pool, maybe best to wear goggles.
It definitely lessens the chances, but there are still some persistent, microorganisms that sometimes survive these types of conditions. And even if we think that way that it's safe, sometimes it can also be transmitted through the swimming pools, even if it's chlorinated.
And even at the beach, you said there have been cases, so it can survive like the salt water, or
yes, the salt water. Yes, but these are also more common in patients, especially that are wearing contact lenses as well, especially for the bacterial type of conjunctivitis. So they are more at risk. So for the contact lens users out there, I hope you take care of your contact lenses, and try not to swim with your contact lenses on, whether you're at the beach or you're at the swimming pool, because it does increase your chances of getting conjunctivitis. as well as more serious eye conditions like corneal ulcers and stuff like that.
Okay. Can wearing contact lenses, I'm just curious, affect your retina?
Yes, it's more on the anterior surface of the eye, so it affects more of the cornea and the conjunctiva.
Okay, so it's not gonna like really get to the towards the back of the eye with the retina. Just curious, like if it could scratch your all the way back there anyway. And as we know, a lot of contact lens users. Well, I'm wearing glasses myself, so of course I've tried contact lenses. And if you're like you're out, then you get lazy or you don't change the solution, or I have, of course, like close friends or family who have like kept, one time I had a cousin who said, "Oh my God, my contacts have been in my eyes for like 2 months now because I have bought solution." So, and she didn't have an extra pair of glasses. So that kind of thing can happen. So I'm glad you talked about it. I mean, it's so common. It's everyday life for many people. And, also even just like someone may be handing you your glasses, or, you don't clean your glasses enough. I mean, all of these things touch our face and the surfaces, not to freak people out, but,
Yes. So I'm glad you brought that up, Dr. Nicole, because a lot of things that we do in our daily lives, it comes automatically, right? Touching things, doing makeup, I'm glad that in the time of the pandemic, a lot of people have been washing their hands, because that's a very important step in preventing the transmission of the contagious types of conjunctivitis. So even, for example, I tell my patients that have conjunctivitis when they're at home, one of the ways that they can prevent other people, especially their loved ones and family members, from getting conjunctivitis is by not sharing certain household items like towels, like
even
blankets, yes, like pillowcases, because those types of materials can pwedeng dumikit doon yung virus, no, for hours to days. So I tell them na best that the towels, the blankets, and all those materials that you use for yourself, don't share it with other people, at least in the meantime that you have active conjunctivitis. Just keep it to yourself. Okay. And keep washing your hands as much as possible,
Perhaps you can circle back a little bit more to prevention later, but I'm glad you mentioned the towels and all. You're sharing a bathroom, you're like, "I'm just gonna dye my hands on her towel," and not use her own towel. So, yes, we've all had relatives or whatever when you're growing up with your cousins. I guess you know how it is, like, or just you this. So
Yes.
a lot of that, and even down to the pillowcases. I'm often these days I often really have no choice but to share my pillow and my pillowcase with one of my dogs. She just insists, and when I wake up, she's there. Actually, she wakes me up. So, but it's okay. Probably we're both not gonna get it from each other. Okay. So, doctor, you're talking about anyone of any age getting conjunctivitis. I remember coming across something quite some time ago. Perhaps you can correct me if I'm wrong, or tell me about it. There are babies that get conjunctivitis. Oh, by the way, and we'll talk about toxic conjunctivitis in a bit because you mentioned it. I did not even know that existed. Is there another reason that they could have conjunctivitis? Like because their eyes aren't totally developed yet, or there's some kind of tear? Is that how would you classify that? There's still conjunctivitis, but it's not because it's just viral or bacterial or even allergic.
Okay. So this is for Dr. Nicole. This
Oh, sorry, I'm
we're
not a
talking about
doctor.
the
But you can,
pediatric population.
okay, yes.
Okay.
All right.
Yeah. So there in cases, even newborns can get conjunctivitis. So for example, in cases that because of the passage of the baby through the vaginal canal, and depending on let's say, on the patient or the mother, if she has a concurrent infection with the time she delivered the baby, she may transmit those bacteria. No, we're talking about specifically Neisseria and then chlamydia. So these are the specific types of bacteria that can be transmitted to babies. So it's been a practice for newborn babies to get prophylactic treatment when they get delivered, so as to prevent as much as possible any type of bacterial conjunctivitis, especially because, for example, for Neisseria type of conjunctivitis, that can be particularly aggressive. And that can cause perforation of the cornea. And so that's something that we try to prevent as much as we can. And if there are any signs of those types of conjunctivitis, it's something that we have to recognize and manage as soon as we can to prevent any complications.
So, Dr. Malongat, when you say that that babies are given prophylactic treatment already, as a practice, is it because the doctors know the mother's history, or like, do you wash the baby's eyes and check them as soon as they get out, even if they're not open, or that kind of thing? Like, do the doctors who help the mothers give birth, or the OBGYNs, do that? Is that the kind of practice they do? And then if they see something, they refer the baby to an ophthalmologist like yourself?
They usually refer the baby only to the ophthalmologist if they suspect that there might be an infection of the conjunctiva. I think part of the history taking prior to birth is asking for any infection that the mother might have. But as soon as the baby is delivered, I think it is part of the examination, no? The full physical examination of the baby, to include examination of the eyes, if there is any infection, if there are any deformities, such things like that. But let's say if they don't suspect any inflammation or any infection, it's not really necessary that they refer it, not every birth to the ophthalmologist.
Okay, thank you, doctor. Now, you did mention earlier Neisseria and chlamydia. Chlamydia, we know, is an STD, a sexually transmitted disease. So that would probably be taken by, history or something. Even women who are monogamous and who are pregnant, maybe their partner has not been monogamous when they were pregnant. Oh my gosh, another surprise. Then they have to give birth with that kind of condition on their mind. But what is Neisseria? Can you tell us a bit more about that? Because so that we can learn more from you.
All right. So Neisseria is a type of bacteria. It's specifically what we call a gram-negative intracellular diplococcus when you look at it at the microscope. So there are two types of Neisseria, usually Neisseria gonorrhea and Neisseria meningitidis, both of which can cause bacterial type of conjunctivitis.
You mentioned
both, yes, and this can be acquired. This type of bacterial conjunctivitis can be acquired by both neonates as well as adults. But the reason that we are more worried when it comes to these types of infections, because they cause what we call a hyperacute type of conjunctivitis, meaning a short incubation period, and then upon examination, we see a lot of signs and symptoms that can give us a clue that this might be a Neisseria type of infection. So it's very purulent. The discharge that we see on examination, not even using the typical slit lamp or the microscope that we use in the clinic, even grossly, we can see that the discharge is quite very yellowish, very thick. It's very purulent as compared to the other types of conjunctivitis that we normally see, especially compared to viral. It's not that purulent. It's more watery type of discharge. But aside from that, it can cause corneal ulcers or corneal infection as well. So the cornea is the transparent layer of the eye that is in the center of the eye. And sometimes it can cause melting of the cornea as well if the infection is not controlled. And that's something that we don't what you want to prevent at all costs, because once corneal perforation has occurred, then that can cause serious visual problems and visual complications. So that is one of the reasons why Neisseria gonorrhea as a type of infection, not just for the conjunctivitis, but for cornea as well, is something that we want to prevent as much as we can.
Thank you, doctor. And you did mention that it's not just babies passing through the birth canal, but also adults can get it. Perhaps, well, if you, let's say, I mean, is it from practicing fellatio or cunnilingus? I mean, people might think they're safer that way, but hey, here's another thing you have to watch out for.
Yes.
With your eyes.
So,
your eyes.
Yes, as mentioned, doctor, since these are sexually transmitted diseases, no? Neisseria and chlamydia, so spreading directly from the genital to the ocular area, or from the genital to the hands, and then from the hands to the eyes. So
that's right.
So those are the types of ways that we can get it sexually. So these are definitely more common in couples or those practicing without any protection. So that's why it's also important that, especially if you're aware that of these things, then it's best to practice with protection as much as we can.
See how interesting the discussion gets, and how in depth, and how like it's really part of everyday life that we just take for granted.
Right.
So I mean, I really like, thank you for sharing so much information and being so educational on I mean, educating us on this show. A doctor, please come back anytime. I'll already invite you in the middle of the show, but the show's not over yet. Okay, can we have a mythbuster? I mean, I would like to ask you about a mythbuster. No, why were, I don't know how old you are, but why were some people, and actually some people still are under the impression, especially here in the Philippines, that you have to wear, or you should wear, sunglasses when you have sore eyes or pink eye or conjunctivitis? Is that something that a doctor like yourself, an ophthalmologist like yourself, would say, wear sunglasses for some kind of medical reason? Or is it just, something that happened? Like, to be...
Okay. So for me, there's actually a good use for wearing sunglasses for those patients with conjunctivitis. The first one is because the eye is inflamed, the conjunctiva is inflamed. Our patients with conjunctivitis are usually very light sensitive. And so wearing sunglasses, especially when they're outside, especially nowadays, Dr. Jacinto, when the
sorry, I'm not a doctor.
Is so bright.
I'm not a doctor. Just call me Nicole. No, I'm sorry. I'm kind of flattered. Thank you.
But yes, especially nowadays when the sun is so bright.
Yeah.
A lot of the patients are quite light sensitive. And so wearing sunglasses will definitely help them be more comfortable when they're outside. So that's number one. And then the second one is, a lot of patients, especially kids, they can't help but rub their eyes or scratch their eyes. Okay? So even if, as much as we tell them that even if you feel the itch or discomfort, try not to touch your eyes, there will be still some of them, whether intentionally or not intentionally, sometimes they will rub or scratch their eyes. So wearing sunglasses sometimes prevents them. Their hands will touch the sunglasses, and they will be reminded, oh, it's a good thing I wore my sunglasses. I didn't touch my hands with my eyes. So that will also serve as a reminder for them not to touch their rub their eyes or touch their eyes.
Even for adults, I mean, oh yeah, I almost scratched my eye. So that's great, doctor. So So that's okay. So that's not there are two reasons for that. When you have conjunctivitis, you're even more light sensitive, like especially these days when, the sun is very bright where we are right now in Metro Manila and other parts of the country of the Philippines as well. And you can, as you said, when you have conjunctivitis, you can become more light sensitive. And as for the children, the same thing. You would ask them to wear sunglasses, or you would probably recommend it. Please jump in and correct me anytime if I'm wrong, or
Yes.
because it also serves as a reminder, like if you're about to scratch your eyes. I mean, I think even grown-ups, it's hard to tell adults not to scratch their eye. I mean, there's really the tendency, to do that when your eyes are itchy.
Yes.
So that's why it's okay. So wearing sunglasses is okay. It's not just because people are hungover or they're trying to look cool. No, it
Yeah.
really,
And in
it
addition,
is really,
I do would like to add that it's also serve as a physical barrier, for anything that might get into contact in the eye. We have some patients, sometimes we do tell them as much as possible, try to stay at home, okay?
Mhm.
But if you do have to get outside, at least that will prevent the wind or any some sort of foreign body material getting into contact with their eye, because aside from being light sensitive, they're more susceptible to to getting hurt because
Mm.
of any material that might come inside the eye. So that's also serves as a physical barrier and physical protection while while they have active conjunctivitis.
I mean, yes, anything. I mean, the wind could irritate it even more, and they could get injured by like dust particles or anything,
That's
smoke,
correct.
any kind of thing, and your eyes are already, not at their best. You're actually ill. So thank you for telling us that, doctor. You're very, very um detailed and very informative. And I will ask you about another like myth buster right before we go on a short break, and then come back to talk more about it, the symptoms, the diagnosis, the treatment, and get into all of that. Okay, many people in the Philippines used to think, and some still think, because I asked around before the show, that if you look into someone's eyes, like if they have sore eyes and you look into someone's eyes, that you can get it.
Okay. Yes, that's just one of the very common myths that we get. Again, the more common route, the way that the virus or bacteria is transmitted is through direct contact. So just to answer the question directly, you cannot transmit, or you cannot get sore eyes by just looking at another person's eyes that have, or that a person that has conjunctivitis.
Yes. It probably started from like, everything spreading around, basically being near the person. So I don't even want to look into your eyes. So that is a myth. But as for the sunglasses, it's not a myth. It's actually a good thing if you have sore eyes,
Yes.
eye, as it's more commonly known, or yeah, how we all call how we call it, like their nicknames. But it's conjunctivitis, and there are different types, as you've said. Okay, doctor, and folks, we're just gonna go on a short break, but we'll be right back, and when we get back, we're going to talk about, we still have to talk about allergic conjunctivitis, and then we'll also talk about signs and symptoms of the different, doctor already discussed the signs and symptoms. Well, no, we haven't yet. Okay, so never mind, I'm getting ahead of myself. But we're going to talk about signs and symptoms of each type of conjunctivitis, and how the doctor diagnoses it, and how it's treated, and some prevention and all of that. And we have a very good guest speaker on the show today. So stay tuned to Healthline with Makati Med. I'm your host, Nicole Jacinto. Our guest is Dr. Justin Manlongat, who apparently is the cousin of a friend from a long time ago when I was a lot younger, like, 2 years ago. No. Okay, just kidding, doctor. Let's not talk about our ages here, although I'm not really ashamed of that. Okay, so doctor and folks, we're just going to go short break. Stay tuned to Healthline with Makati Med. We just have some important reminders for you about Makati Med also and Makati Med services. So we'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗂𝗍𝗂 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. 𝗂𝗍𝗂 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗛𝗶𝘶𝗵. Available for outpatient care services, our 𝗛𝗶𝘶𝗵 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗛𝗶𝘶𝗵 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗛𝗶𝘶𝗵 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗛𝗶𝘶𝗵.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, hi everybody, and welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto, and we have Dr. Justin Manlongat with us today. He's an ophthalmology specialist. He's an ophthalmologist who practices in Makati Med, of course, and sorry, excuse me, just an interruption here in the studio. Somebody had to get paid right in the middle of the show. Well, it happens. And we are talking about conjunctivitis today. And earlier we discussed, a doctor actually told us how we get bacterial and viral conjunctivitis and that it can overlap. I mean, we talked about like how people of all ages can get it. Before we ask about the signs and symptoms of conjunctivitis, can you tell us a little more about allergic conjunctivitis, like how um, how is it different in a sense? And like some people think that you can also get infected from someone who has allergic conjunctivitis.
All right. So allergic conjunctivitis, the primary symptom that is associated with allergic conjunctivitis is primarily the itchiness of the eyes. So as we've discussed at the start of the program, Nicole, is that allergic conjunctivitis belongs to the category of non-infectious type of conjunctivitis. So if you are diagnosed with someone with allergic conjunctivitis, so don't worry, it's not something that you can transmit to other people. It might look scary also because it looks red. It might also come in a little bit of discharge. But one of the distinguishing characteristics that the symptoms that a patient with allergic conjunctivitis has is that it really itches a lot. No, we get that sometimes in the viral and bacterial type, but not as much as we get from the allergic type of conjunctivitis.
Okay. Thank you, doctor. Okay. So let's get to the signs and symptoms that a person may have if you have conjunctivitis. So for viral and bacterial, you already started discussing it. Anyway, are there any differences? Oh, if there are any differences, let us know, doctor, between with regards to all the symptoms. I guess discuss all the symptoms of bacterial, viral, and allergic conjunctivitis, and just point out if there's a difference in symptoms so that the audience may learn some more.
Okay. So in terms of symptoms,
I can learn some more.
Right. But in terms of the signs and symptoms, there is an overlap, like I mentioned. You know, all of these types of conjunctivitis will present with redness of the eyes because of the inflammation. All right. Some of them will have some variable amount of discharge, but that is also one of our distinguishing signs that we look for when we examine using our slit lamp, what we call, or the microscope, in order for us to have a magnified view of the eye. So sometimes the nature of the discharge when we look at patients is that it might look a little bit different between bacterial, allergic, and then also the viral type. As mentioned, for example, in the case of a bacterial conjunctivitis, the tendency is for the discharge of the eyes to be more purulent or very yellowish or very greenish and quite thick.
Yellowish or thicker, yes.
Compared to let's say the viral or allergic conjunctivitis. For allergic conjunctivitis, the classic discharge that we usually read in the books and sometimes see in the clinics is that the discharge is quite watery. It's more on the clear side compared. And then for viral, it's somewhere in between the bacterial and then the allergic type of discharge. And of course, when it comes to the history as well, for those that have allergic conjunctivitis, most of these patients have a past history of all other allergic conditions. Let me name a few of them. Some of them will have allergic rhinitis. Okay. Some of them will have bronchial asthma or skin asthma, some type of eczema. Okay. Not all patients, but a lot of patients will have these types of conditions. And then, like as I mentioned, because of the exposure to certain types of allergens, okay, depending on the type of allergic conjunctivitis, because we have, we can subdivide the allergic types of what we call the perennial, meaning these are certain, you can get this type of allergies all year round, whether it's summer, rainy days, even in other countries that have 4 seasons, any season. And then there are specific types of conjunctivitis, what we call yung during seasonal type of conjunctivitis, and which is more common in the Philippines during the summer season, like pollen and stuff like that. Okay. And then if you're aware of certain types of allergens that you have, for example, certain medications or food or animal dander, things like that, then if you're exposed to those types and you have a history that you've been exposed to those types of things that you're allergic to, then that gives us a clue that this is probably allergic conjunctivitis. Okay.
So it's okay. Sorry, doctor. Go ahead. I didn't mean to interrupt
Yes.
you.
So yes, as I mentioned, itchiness is one of the main symptoms. And then for viral conjunctivitis, a lot of viral conjunctivitis, we have what we call lymphadenopathy or yung colanic in Tagalog, especially in the preauricular area. So this is more common in patients that have viral conjunctivitis. And since a lot of there's an overlap as well, there are certain viruses. The most common type of virus that's causing viral conjunctivitis, we call it adenovirus. This adenovirus can also cause the common colds. And so we have some patients that present or come with us that also have symptoms of upper respiratory tract infection, such as common colds. And so they usually come with conjunctivitis, some of them, and given that that presentation, we're most likely to diagnose these patients having viral conjunctivitis. So yeah, but there are definitely signs that we look for in our ocular instruments in the clinic that gives us more clues that this patient might have viral, bacterial, or allergic type of conjunctivitis.
Thank you, doctor. That was so great. I mean, everything that you said, you just, practically named everything, and you gave us a clue really on how to tell us the difference between allergic conjunctivitis, and that you can get it often. There's perennial, there's seasonal, and usually here in the Philippines it happens now during the summer. And even though we don't have 4 seasons, there's there's like grass pollen, so still some tree pollen, dust, and as you said, usually patients have allergic conjunctivitis. They tend to have other allergies as well, like rhinitis. So they have the itchy nose all the time, or maybe their skin breaks out or skin asthma. And then you did say that that if it's viral, sometimes you'll get a clue that the person has actually the same virus that causes the common cold. They might have a cold also, and then the watery eyes. Because sometimes when we have a cold and we're sneezing, or even an allergy, we have watery eyes. So it kind of all plays together. Right. It doesn't probably always start with conjunctivitis, but then it can all like manifest at the same time. Okay, so doctor, how you're talking about this now, and how do you diagnose conjunctivitis? You talked about the like when you look under your microscopes and all of that. Can you tell us like how do you diagnose it in your clinic?
Correct. Well, most cases of conjunctivitis that we see, especially nowadays in the summer season, for most types, at least for viral conjunctivitis, it's just we're basing it off on the history of the patient and just the physical exam. Most of the time, we don't do additional tests. So just from the appearance and the way that the history that the patient tells us, just in the clinical exam, then we have a very, very, very good idea if this is viral conjunctivitis. No, barely do we do testing and other laboratory tests. We usually do that for cases only that do not respond to the initial treatment that we usually give to the patients. Especially, for example, when it comes to, example, in cases that we do suspect that this patient has bacterial conjunctivitis, especially gonorrheal conjunctivitis, then definitely I will be inclined to take a sample of the eye or of the discharge and send that to the laboratory for them to confirm if it is that specific type of bacteria that's causing gonorrhea, or maybe even chlamydia, or whatever it turns out to be. But we barely do that. The good thing about conjunctivitis, Nicole, is that, especially for viral, and most cases of bacterial conjunctivitis, simple cases of bacterial conjunctivitis, is that these are self-limiting conditions.
Okay.
So usually they last around 7 to 14 days. A
Yeah.
lot of factors come in here, depending on the immune system of the patient and how virulent the bacteria or the virus is. But usually it lasts 7 to 14 days, even without treatment. The treatment that we give for these types of patients is just supportive, meaning it's just to manage their symptoms, their discomfort, until the condition has been controlled, no, by
So
the
type
by
of
the by the body's own defense systems.
okay, so they're pretty, as you said, the good news about viral and bacterial is that they're pretty self-limiting, and if it's allergic conjunctivitis, then you would also know how to treat that with, I
Yes.
guess,
So for certain types, for allergic conjunctivitis, depends also on our findings, but some people will benefit from being given antihistamines as well. So depending on the severity, sometimes we give topical antihistamines, okay, like and then also oral antihistamines for certain patients, especially if there are systemic symptoms of
yeah,
allergies, not just in the eyes. So, for example, lid swelling and then some
or
patches around the body that might indicate that it has also affected not just the eyes. We usually also give oral antihistamine. So these are certain cases that patients will develop from specific type of treatments. So it's very important that I tell my patients that if you have red eyes or if you have pink eyes, that if you're not sure, that you do not self-medicate,
Mhm.
and that
Mhm.
you see your ophthalmologist
Mhm.
who can advise you what the best step is in treating your type of red eyes, because not all red eyes or not all conjunctivitis are the same.
Are the same, and the treatments could be different. Doctor, so okay, when it comes to allergic conjunctivitis, you can treat it with first when you diagnose, no, the clinical history. I just wanna always emphasize this to regular people like myself out there. Please be honest with your doctor. I mean, don't be embarrassed, and like for example, with the bacterial conjunctivitis that you can get from STDs. I mean, when you do the clinical examination and you interview, you have to be like a detective, don't you? That's the reason why I
Yes.
ask a lot of questions. And then just be honest. If you're not really comfortable with that doctor, then move to another one or something. But you have to be at the bottom of it sometimes, right?
Right.
Um,
So sometimes
it might.
it really is an art and science when it comes to getting the history out of your patients, how to make them feel
Yes.
comfortable with you, because it's
Mhm.
understandable that for certain types of STD related infection, including the eyes, it's
Yeah.
understandable that some patients are hesitant in disclosing these types
Mhm.
of information. So I'm glad, yes, you're correct, Nicole. It's sometimes difficult to get the correct information from our patients.
And then, if you're kind of hesitant, don't bring anyone with you, just you and the doctor,
Right.
unless you really trust the person or it's a good friend or your primary caregiver. And
Correct.
also, doctor, you did mention you give supportive treatments. What are the types of supportive? There could be medicines, oral or topical. You give eye drops, and then just supportive treatment
Right.
for the usual time. You said like 7 to 14 days while the
Correct.
patient is uncomfortable. What can they do when they're at home? Like you send them
Okay.
off with some medicines,
So,
and what
yes,
else?
the usual regimen I prescribe my patients with simple viral conjunctivitis is that I give them topical, what we call artificial tears. These are usually drops that we use for dry eyes, but in cases of conjunctivitis, they can also help decrease the symptoms such as itchiness, such as
Mhm.
foreign body sensation, and sometimes that stinging sensation that they will have. One of the
Sandy, no? Yeah.
advantages of using those eye drops as well is that it helps wash out the discharge that they have, especially if the discharge is quite significant. And then I
Mhm.
also tell them that you can do cold compress as well. So you can use a towel or a clean cloth, such as cotton pads, and then that will help cool, give that cooling sensation and help lessen the hyperemia or the redness of your eyes, at least temporarily. Okay, but it's
And
more of the feeling that it helps, that it lessens the discomfort that most patients have.
is there a proper way to wash your eyes or your face when you have when you have conjunctivitis? Or do you like
Okay.
just cup it in your hands, but make sure your hands are clean, cup it and or do you
Yes.
just like okay, don't touch your eyes at all? Is it okay to shower, get water in
Uh,
it?
so definitely when you're trying to clean your eyes, I usually tell my patient definitely to try to use a clean cloth every single time. And then wash your
Mm-mm.
hands before cleaning it. And then preferably a wet cloth, because a lot of patients, when they try to clean their eyes, it's quite crusty. And some of them, when they wake up,
Yeah.
they have difficulty in opening their eyes. Okay? So using a wet cold cloth can
Mm.
at least give that sensation that it's cooling and less irritative, but it will also help break up the crust in the eye. Okay?
Okay. So
And then for
that's
some
the
patients,
best
I do
way.
tell them definitely some of the don'ts is don't use any contact lenses. So I tell my patients
Mhm.
always have a backup pair of glasses, because sometimes we have patients that only have contact lenses. So what happens is
Yes.
if they do get conjunctivitis, it becomes a problem, especially if the grade of their contact lenses is quite high, and I tell them not to use their contact lenses. They become, they have blurred vision because they don't have backup glasses. So it's
And
very
sometimes they
important to,
travel for backup. Yeah.
yes, always have glasses. Okay, it's okay to have just glasses, but never just contact lenses. If you're going
Thank
to
you,
have,
doctor.
uh,
Yeah. Sorry, doctor. Okay, I'm told we're a bit running on time, so I'm gonna ask you questions really fast. Sorry about that. I don't mean to rush you. It's just been
no,
so
no problem.
informative and enjoyable. Okay, what are the best ways to avoid or prevent conjunctivitis? Like if one already has conjunctivitis, how do you stop it from spreading? Should you stay home?
Right.
If you have to go out, what should you do? Okay.
Yes. So
I mean, even if
as,
you're
as
home, you can infect.
yes, that's correct. So, for example, I usually tell my patients in the office setting, those are working in crowded places, definitely, if you have the infectious type of conjunctivitis, is to stay at home, at least depend until the condition resolves, because other people in the office might get it. Okay, so when
Yes.
you're at home, even your family members, always wash your hands. And as I said, uh, when it comes to the eye drops, make sure that you're the only person using the eye drops. I tell my patients this as well. If you're unlucky and some of the patients do get the conjunctivitis, do not let them use
Mhm.
your drops. Okay, those drops are for your use only.
Yes.
Okay, so that's one thing.
Buy
And as I
your
mentioned, towels, blankets, pillowcases, whatever is yours is for your use only. And then for my patients, dear patients that have only conjunctivitis in one eye, if you're going to clean one eye, just make sure that the other eye is not affected. But what you don't want is, remember I mentioned this before, that 1 to 2 weeks is the usual time for viral conjunctivitis. If the other eye gets infected, it's going to be another 1 to 2 weeks. Okay,
aha.
it's going to add
And it can
another one to
extend.
two weeks, and have no choice but to extend your leave if you're asking for a medical certificate. Okay, so try to follow our instructions as much as you can, so you don't stay out of work too long. So that's one. Okay, and then when you use the computer, I have, for those working at home using their computers, I have no problem with that. You're very functional. You can use your computer. But again, you might not be the only person using the computer in your household. So please sure that every time you use the computer, try to clean the keyboards, the mouse, everything that you've used in the keyboard, so that if someone else
Mhm.
has to use it, then their chances of getting conjunctivitis is lessened considerably.
And then, doctor, just for children, no, because like, just quick question: are children more at risk of getting it like because it's spreading in like schools or maybe even tutorial places, or if they do after school sports and all of that? And what role do you think that parents and maybe even teachers or coaches or anyone can play when it comes to help spread the prevention of conjunctivitis if there is one or two or maybe even more cases?
Yes. So thank you for bringing that up, Nicole. That's a very good point. Yes, we had a lot of cases where children among the same classes and or even the school nagkahawaan, or they got the virus or the bacteria, because it tends to be very crowded in classrooms. That's one of the major risk factors of getting the condition, because of the contagiousness and people being near each other. That's why during the time of pandemic, where people were avoiding each other like the plague, I barely got any cases of conjunctivitis because no one was around anyone. Okay, so it's very important to tell the teachers and everyone, the staff around the classroom, if you suspect any of the kids in your class, in the school, of possibly any form of conjunctivitis, or if you're not sure, better to send them home, have them see, have the parents consult, see the kid, the ophthalmologist see the kid, and and stay at home until the ophthalmologist gives the go signal that the child is good to go and clear of the condition, so that when the child goes back to school, then there's no possibility of getting or transmitting the condition to other kids. And the other thing kasi in the classroom kasi is the kids, they barely listen to what the adults are saying, especially when it comes to washing their hands. They just rub their eyes.
And that excuse you every 5 minutes to wash your hands. Now you can't go to the bathroom, or like, somebody will borrow your ball pen. I forgot my ball pen today. Or, touch your, I don't know if they still use pencil cases these days.
Yes, diba? Sabi
Anything.
We tell our kids, diba? It's good to share things with your classmates, food, school supplies, and stuff like that. But in the context of conjunctivitis, it can be one of the things that can help spread the disease further. So that's something to watch out for.
Yeah. And sports, you're often using the same ball, then you rub your eyes, whether it's basketball or soccer, whatever it is. Anyway, doctor, okay, we are out of time. Is there anything more you'd like that? Perhaps we can talk about toxic conjunctivitis another time?
Yes, no problem.
It's on the show. I mean, that can probably be a whole show in itself, no? And some of the more like serious repercussions if you don't see a doctor. If you have conjunctivitis and you don't get treated, perhaps we can do that, doc. Let's schedule it. Come on, talk more about us. Okay, but in the meantime, I give you the floor for anything you'd like to say, any kind of advice or like final words or comments to people who thank you for this very informative and educational information you've shared with us. You are really, really a good resource speaker. And if you can give me your number after the show by typing it into this box, then I would really appreciate it. I could have questions for you. And then also like just any final words you have.
All right. So again, thank you, Nicole, for giving this opportunity for me to speak on conjunctivitis. It's a very relevant condition, especially during the summer here in the Philippines. So I just would like everyone to know that conjunctivitis, while it presents with red eye, it's a very common condition, but not all red eyes is conjunctivitis. So you've probably had it before. So let's not assume, let's say if you do get red eyes again in the future, that it's the same condition. If you're not sure, best to have your friendly ophthalmologist in the neighborhood check it for you and to confirm if it is indeed conjunctivitis, just to make sure that it's not an other serious eye condition that can present with redness. Okay? And then please don't self-medicate. Don't share your
Yes.
eye drops with anyone. And then, if you do believe it is a type of infectious type of conjunctivitis, please stay at home, okay? And then go to your doctor so that we can prevent the transmission to our friends, to our office mates, and to our loved ones.
Yes, even at home. Doctor, thank you so much for being on the show. Thank you for taking the time and the effort. And can you please come back on the show soon? We can discuss so much more about,
All right.
talk
No problem,
about
Nicole.
red eyes, what conditions. It's not just that they're drunk. That's why they have red eyes. Yeah, that used to be me, but my eyes would never get red. Anyway, I'd also like to thank Kakampi Bernard Tan for giving us a couple of extra minutes just to really kind of wrap up. I mean, make the discussion whole. Thank you, Bernard, so much. And thank you, Dr. Justin Manlongat, ophthalmologist in Makati Med. And anyway, that's it for Healthline with Makati Med for this week, folks. Tune in again next week on Monday from 5 to 6 p.m. And thank you, Bernard, for giving me the extra time I asked for. Oh, I can see him. I'm waving. Thank you, Bernard. Thank you so much. Okay. Thank you so much, Dr. Manlongat.
Thank you.
I will be asking for your number, but right now we have to go, and we'll see you again next week. And of course, stay tuned to hear Kakampi Bernard Tan. Okay, and hello to all of Bernard's fans. Sorry. Okay, thank you, Doctor. Okay,
Thank
bye,
you.
folks. See you next week.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.